Hi everyone, my name is Micah Guidry. I am the manager here at LaBelle Cosmetic Surgery Center.
Hi, I'm Dr. Jay Purov. I'm the cosmetic surgeon here, board certified.
So we're going to talk about cosmetic breast surgery, which entails a lot in itself, and that encompasses a lot of different patients and a lot of different needs. So first off, we're going to talk about who's a candidate for breast implants and the different options that are out there.
Yeah, first of all, who needs a breast implant? People obviously with very small breasts need a breast implant for their own personal satisfaction. But not everybody needs a breast implant. Having a humongous implant is not a common social goal, even though some people want it. So the person who needs a breast implant needs to be psychologically stable, and it should make a big difference in the person's personal self-image at the end of the procedure. Those are the person who need breast implant. You don't do it for somebody else. You don't do it for your boyfriend. You don't do it for whatever else reason. You do it for your own image improvement. Then it'll be very satisfactory.
So when a patient is interested in breast implants, when you Google that, there's a lot of different options. There's saline, there's silicone, there's different ways it can be put in, different sizes. So how does that work when a patient comes in and says, I want breast implants, and they don't know anything about it?
Of course, we go through a lot of details before we do anything to the patient. An hour of conversation between me and the patient will go on with pictures and everything. Bottom line is, basically there are two types of implants, saline and silicone. Saline has been there forever. Silicone has been there forever, except that the last 20 years or so, silicone has not been used as much in this country because of legal aspects around it. However, today silicones are far better, rapidly coming back into vogue. Saline implants is a bag filled with saline, and it ruptures easily, and when it ruptures, the whole breast will collapse. On an average, you expect to change saline implant every 10 years. Whereas today's silicone implants, even if they rupture in droplets. You may not even realize it ruptured until years pass by. And so, on an average, you keep the silicone implants a lot longer. Today's silicone implants are much safer, much better. They keep the shape better. They leak a little less. They have less complications too. However, everything changes in a human female body. Hormones, weight gain, pregnancy, so many different things, ages, lots of things. So it is a common procedure that requires often repeat operations based upon many factors, not just the implant.
Yeah, I think what we hear from our patients is silicone feels more natural. Saline is kind of becoming old school just because of the new feel of silicone and the way that they look afterwards. Patients tend to be happier with that. So those are the two different options that we have here, and let's talk about how they're put in. There's different incisions, there's different ways that patients can put it under the muscle, before the muscle, so many different ways. So how do you determine a patient getting implants and what technique is used?
Yes. Let's talk about the incision. Incision is a cut you make in the skin. We can put the breast implant in basically three different ways. Most commonly is put inside with an incision under the breast. It's called inframammary. A cut about 1.5 inches long. The second most common place is a cut right under the areola of the nipple. And the least common place is to the armpit with a small cut. The benefit of the armpit incision is once it heals up, nobody will see a scar on the breast, so nobody will even know there's an implant. Whereas a nipple scar may be visible, may not be. Under the breast scar is visible to your partner. So, but under the breast is the most common method used. But we use all these techniques. But there's a rare technique that can be done like this. You can make a small cut in the belly button and introduce an implant to the breast. Usually it's only a saline implant that can be introduced because it's a collapsed bag that can be introduced that length from the belly button to the breast. You cannot introduce a silicone through that. Now that technique is basically going away. The benefits are marginal. So we hardly ever perform that here. However, it can be performed if necessary.
Like you said too, for the patient, saline does come in a collapsed bag. We do put it into the breast and we do inject saline into it after the implants are in. However, silicone does come pre-filled and ready to pop in. So with that being said, when patients come in and they say, my friend has 500 cc's and I want 500 cc's or I don't want to be, how do we determine what patient gets what size?
Don't ever compare yourself to your friend or somebody else. Somebody's 500 may be small for that, your 500 may be too big for you. It all depends on each person's individual measurements, chest measurements, the distance of the nipple between the neck to the nipples, distance of the nipple between the midline. There are so many measurements we take. What we choose is the measurement that fits for your breast. It has nothing to do with your friend's breast or anybody else. So you cannot compare the cc's involved in that. For example, somebody with a tall person with a wide frame, 500 cc may be a small breast, whereas a short person with a thin frame, 500 cc can be a humongous breast, and reverse is also true. So we really do not put the numbers there, we put the size there that matches your body.
That's a good way to do it. So now that we know the differences between saline and silicone, let's talk about the patient that needs something more than that. They may need a lift or a reduction. Patients that have had kids and they're stretched. Those are the different patients that need a little bit more than just implants.
Absolutely. Everybody thinks breast can be improved by putting an implant. It's not true at all. Basically, the breast needs to be in the basically normal shape to be able to put a proper implant. Now, when the breast sag, the technical lingo for that is called ptosis, P-T-O-S-I-S. And we measure them in degrees, sagging first degree, second degree, third degree. Anything less than first degree may be managed with just an implant. First degree or higher sag, you need a lift also. Some people just need a lift, they don't need an implant. Some people need a lift and an implant. Some people need a reduction. So, it's a complicated thing, but implant doesn't solve all the problem. Lift doesn't solve all the problem. Reduction doesn't solve all the problems. But these can be mixed and matched based upon individual needs. Let's talk about lift and reduction. It's confusing terms. It's technically the same operation, except in the lift, you don't take volume of tissues out. But in the reduction, you actually remove breast tissue and skin. It's a technically similar operation to lift. Why would somebody need an implant if they're having a reduction? That's the biggest question to be answered. Most people cannot understand that. When we say a lift doesn't lift the breast up to the neck. Lift tilts the breast up. So what happens is, suppose you have a big breast here, a reduction or a lift, the breast more or less tilts, becomes smaller but tilts up, but it doesn't go up. What that does is to create a shallowness in the upper part of the breast. If you want a bulging upper part, you need an implant to create that. That's why many people require a lift and an implant, reduction and an implant. It sounds like an oxymoron, but it's true.
And that's, we do hear that a lot. Patients do think that if they lift, everything comes up, and it's not the case. When we're lifting, we want the areola and the nipples to go back to where they were first. We fix that problem first. Then you look at the volume here. And different patients are different. You can do all of those procedures at the same time. You can wait and do them separately. So it's just the patient's individual needs, what they want to see done. And to keep in mind the incisions that we talked about in the first time, there's only one incision for a breast in a lift, and that is all around the areola, some cases all the way down underneath, and can be hooked like an anchor or a T. So there's different ways for that, but that is the only option when it comes to reduction.
Yeah, when it comes to lift or reduction, that obviously the nipple needs to go up. That means you have to cut around the nipple. Obviously you'll have a scar around the nipple. Then the lower part of the breast needs to be raised. Obviously you won't have a cut in the lower part. Now this is where variations happen. It can be minor or it can be major. It depends upon the initial breast size and the sac. So a lift or a reduction is definitely a procedure with a lot of scar. Okay, but believe it or not, I have a lot of happy patients with implant, but I've not had a happier patient than a reduction or lift patient. They are happier than the implant patients, simply because they have been tired all their life about a huge breast carrying it out.
Yeah, and the weight. We do hear that a lot. So recovery for both of these procedures is pretty much the same. We have you wear a compression garment. It is a medical grade garment that we do provide for you. You wear that. The incisions are very delicate. Why don't you go into detail about that and the differences?
Yeah, incisions are very delicate. I mean, there's a slight difference though. Recovery means different things to different people, obviously. You're not laying down in the bed for 2 weeks. That's not how it is. You're walking around the same day. Most patients, lift or reduction or implant, they'll go back to their routines in just a few days, just maybe 3 or 4 days. And only thing is, reduction and lift involve a larger scarring. It takes longer time to heal. Complication rates is certainly higher than just a straight implant. But basically, pain is not a major issue. Most people just have soreness, Tylenol. This is something, sound like nobody believes this when I say this. I couldn't believe it, and a patient's telling me this. I don't want them taking Tylenol. Believe it or not, it's true. And some people occasionally need something more. Of course we give pain medicine, that's not a problem. But people imagine extremely painful procedure. It's not so. Soreness, yes. Pain, rare. Okay? But you have to wear a compression garment up to 3 months. The breast that has been lifted has to heal well, in shape. Most important thing I want to emphasize is all breast cosmetic surgeries done by anywhere in the world, at least 15% of them will require revision for many reasons. So this is something patients are not aware of. When a reoperation happens, they are very upset about it. But I make it a point to say that from the beginning.
Yeah, when you're thinking about getting any kind of cosmetic breast surgery done, there's a lot of factors that you do need to be prepared for. Having children, menopause, weight gain, weight loss. So just because you have a reduction doesn't mean your breasts don't come back, doesn't mean you won't have to have another reduction later. And the same with implants. Your body may not take to them, you may have to get them redone. There's several different options that you need to be mentally prepared for, but like he said, these are some of the happiest patients because women feel a lot better after they have these procedures done, no matter what option they choose. So when you're ready for a consultation, when you're thinking about this, come in and talk to Dr. J. Let him see the areas, see what's bothering you, and let us help you maybe better make your decision on which implant to choose, what type of procedure you need, and when the right time to do it is for you.
Yes, one other thing we didn't mention that I just want to mention this to you right now. Among the silicone implants, it has come a long way. The old-fashioned silicone is a bag full of silicone. When it touches, leaks like oil. Those are replaced today by gel implants. When they leak in just like a jelly substance, small droplets. But the newest form is called cohesive gel. That's even more cohesive than the regular gel implant, which is most commonly used. The cohesive gel implants are the newest thing in the market, very expensive, and they don't leak. When you cut it, it stays like, as you cut, the shape remains the same, nothing leaks. That's the newest thing in the market, but it's not quite popular yet, not caught on yet. So the terminology can be very confusing. Also, different companies make the implants, they call it different names. So it's totally confusing until you come and talk to a physician who knows all about it.
And call us whenever you're ready. Thanks.
Thank you.